First thing I'd like to do is have our panel introduce themselves and ask them to talk about what they do professionally and how it relates to the topic of homelessness.
Hi, my name is Heather Eicholtz, and I work for 211 New Hampshire, and we are the statewide information and referral line. That's a program of the United Way. We run the statewide homeless hotline 24/7 every day of the year, and we also are doing the intake for the Home Help New Hampshire program, which is a foreclosure prevention and intervention program.
My name's Dan Andrews. I'm the fire chief of the city of Concord. I have been in New Hampshire for about 6 years. I came from Salt Lake City, Utah. I have a total of 35 years in the fire service. Frankly, most of what my emergency response time was, firefighter, paramedic, lieutenant, captain, was taking care of homeless folks. We could run 6 or 10 times a day. People who were homeless, who didn't have any way of accessing the medical care system other than 911. And when I came to New Hampshire, there was a dream about ending homelessness in this city. That captured me, and I'm glad to be a part of the Concord Coalition to End Homelessness and to participate in the city steering committee to end homelessness. And I'm very excited to talk a little later in this presentation about what's happening there.
My name is Lori, and I actually wear 2 hats tonight. First of all, I am actually one of those families. And about 6.5 years ago, same time frame as in the movie, I owned a home. I had just started a small business. My husband had had the same career for 30 years. We had 4 children at home and 1 on the way, and he was laid off. And through a whole lot of events and ending up homeless and actually staying at Friends Emergency Housing for 9 months, best thing I ever did, and now I actually am program coordinator there as of last December. But I've been with the program working there for 2 years.
Heather, could you just a little bit? I know 211 was mentioned in here, and obviously that's a key resource for folks who might not be aware. Can you tell us a little bit more about what 211 does? I know you mentioned a little bit, but how it relates to, and maybe even how it ties. Lori said she's with the Friends program. There's certainly other organizations, and 211 plays a key role for folks who aren't directly familiar with those organizations. Maybe you could tell us a little bit more about what 211 can do for folks.
211 is the number to dial in New Hampshire when you need help with something and you're really not sure who to call or who to turn to, or if there might be help for that somewhere in your community or somewhere within the state of New Hampshire. I think the easiest way to think about 211 is that we're the connector between the resources that are out there to help people and the people that need help. So we're really bringing the two together. Just turn that off. And connecting people with the help that is available and letting them hear from us, after talking with them about the situation that they're in. These are the options that are available. These are the resources that are out there. And unfortunately, sometimes having to tell people that there really isn't a lot of help for some of the things that they need help with too. Through the homeless hotline that we provide, we're able to connect people with homeless services every day, including contact information for the Friends program in Concord, shelters statewide, connection with homeless outreach workers statewide, with transitional living programs, with transportation. Basically, anything that you might need help with, or anyone might need help with, whether it's a friend or a neighbor or a family member. We get calls from all kinds of people in New Hampshire, moms, dads, grandmas, neighbors, people that have a coworker that might have something going on and they might need help with. And every call that comes in is answered by an information and referral specialist. And everything that's referred, that the caller is referred to for help, is recorded in a database. So we have data available by area, by city, city, town, region, county, that can be pulled out later on not only the caller's needs, but the unmet needs too, when we find out that there really isn't a resource for certain things.
What type of percentage of the calls you receive through 211 are related to folks that are looking for housing or homeless or resources like that, if you have something like that you can offer?
Yeah, I pulled some data just going back a year from April 1st of 2013 to April 30th today of this year for Merrimack County in particular. Over that last year, we took a little over 50,000 calls statewide, and a little over 9,600 of those calls were from Merrimack County. 1,025 of the calls were for homeless services.
And in your professional experience, either in Salt Lake City or back here in Concord, it was referenced early in the movie about how homelessness can certainly play a role in public safety's day-to-day call for service. Maybe you can share your experiences in that regard as well.
Sure. One of the things that I will always say is no matter what statistic I give you, it's low. And no matter how big we think the problem of homelessness is in this community, it's bigger. And just for kicks, last week I was going through some ambulance billing data, and I ran the percentage of write-offs that we do against charges, because we do have a procedure for people who are not able to pay their bills. They don't need it that on top of everything else. That number's up 15% from last year. That's not a recovery number. That is 15% more. It's over $100,000 more in write-offs that are being extended as a percentage of that. So it's a big problem. It's not only homelessness, it is people who are no longer able to pay bills and are able to qualify for a break, either reduction or having their bills completely written off the ambulance bill. So it is very, very pervasive. It's a hard story to tell. But last December, I went with one of our crews on a reported cardiac arrest. And it was a middle-aged man, probably mid-50s, and he was dead. And he was living with his mother. And she was naturally very distraught. And I talked to her and I said, "I'm so sorry, this must be horrible." She said, "It really is." She said, "My other son died last August." And I thought, what kind of life is there? And so many of our calls, when I get out and actually get into the field, are to people who are living in such insecurity, who are so far on the edge. And we're not really the fire department, we are the Department of Unforeseen Life Circumstances. Just yesterday, a man had a fire in his apartment. He's out of that apartment for a while. He's got a lot of challenges in his life. Getting rehoused for him will be a challenge. Red Cross is helping him out. But literally, those are the stories, and those are not captured by a lot of statistics. There are an average of about 253 homeless people in Merrimack County at the 2013 point in time count. There were 22,000 shelter nights in 2013. That's 61 people living in shelters per year. And we know there are a lot more than that. Yesterday, I was in a homeless camp less than half a mile from here on Stowe Street. People are defecating into bags and hanging it up so they don't step in it. That's how human beings are living, literally within a 5-minute walk from this place right here. It's all around us. It's just very pervasive, and sometimes it's out of sight, but folks, it's all around us.
Lori, when you and your family were going through this homeless situation, what did you feel the biggest challenges were for you and your family at that particular time or during that time?
I think aside from financially, the hardest part was, because I had 4 children, 3 of whom were teenagers. My children had all of those emotions, and the feeling of guilt, even though you know that you're trying the best you can, and there doesn't really seem to be a way out. I think the feeling of guilt was the hardest, and trying to not let them see, how concerned and worried you are, or without resolution. Trying to hide that from them, I think, was the hardest. Physically, it was just trying to prioritize between, we cannot get the oil and just buy kerosene. That'll hold us over for a couple of weeks. I actually learned how to bleed a line and restart a pilot. And then, choosing between, which car could we let go, and is it more important to have the car so we could look for work or let the house go? And, after unemployment ran out and there was part-time jobs and times with no work, and my son actually, after he was born at the age of 1, much like these stories, became really sick, and it took him a year to get diagnosed. And I feel like I'm stealing stories, but they're actually mine. He was diagnosed with an autoimmune disease, and it's triggered by food allergies. So he actually has a lifelong feeding tube in his stomach. So when we lost the house, it was kind of like a weight lifted off, because I just had this stress every day of things being shut off, and food, and my children, and as I said, I really, like them, didn't think it would happen to me, and I went from donating on FreeCycle to selling on Craigslist, and it sucked. So we just walked away. We lost the house. We were foreclosed on 2010, March, and, or I'm sorry, 2009, and we moved in with a family member into their basement. My son actually started getting respiratory problems. We were there for a year and found out that he had asthma that was triggered by allergens in the house, and that's when I went into shelter.
I can tell you because I know Lori and thought she'd be a good representative for talking about this, especially when we're talking about families. Clearly the face of homelessness in Concord, since most folks are in here, you see certain people on the street. What is missed very often are families. Families tend to find somewhere to go, and I think you heard that, going to live with in-laws or family members or something else. Because families are very resourceful when it comes to finding ways to find at least some safe shelter for their kids. That doesn't change the fact that they are still in fact homeless, and that their situation does not get better without opportunities. The economy certainly doesn't help anyone. That's a major part of it. We experience, all of us I think, experience stories that people say they really want something, and they don't want a handout. They want to work for things and they want to earn a living. Unfortunately, when they are able to find employment, very often it still keeps them below the poverty line, and they're one broken down car away or one unfortunate medical situation from where they start a whole domino of losing their housing, and one thing leads to another, and they find themselves jumping from one place to a next.
We started this presentation this evening talking about the plan to end homelessness, and 16 days ago, a huge step forward was made when our city council unanimously adopted the steering committee's plan to end homelessness. That's been in the works for about 2 years. It started 2 years ago this month with a resolution of the city council. Mayor Boulay took the reins and provided the leadership and drive to appoint a committee, of which Jerry and I are members, and there are about 16 other people representing everything from financial services to experts in homelessness to public safety to various other government services. And after a year's work, we have a plan. Better yet, we have an adopted plan. It's pretty simple. I don't even think I have to refer to my notes. There are 5 pillars of this plan. The first is to provide an adequate environment for people who are homeless. That includes both a resource center, and tonight we have our new resource center director, Ellen Groh, with us. And Ellen is brand new and an incredible asset to what this city is trying to do there. It also is about where people lay their heads. It's about having adequate housing. And the second part of that is creating a sufficient number of quality rental units for very low income people. The third is about information, educating the community and ourselves about the costs, the needs, and the impact of homelessness. The fourth is funding. And the fifth is stakeholder engagement. I've been with the Concord Coalition on Homelessness for 3 years. That body will expand, and we'll also have an executive level steering committee, and the task of those groups is to provide stakeholder engagement. We have a lot of people working in providing services to homeless people, and the coordination of those services for an effective and seamless delivery system is extremely important. So I'm excited. And behind me, I have sign-up sheets. No password is required. You don't have to go through all that, but it will allow you to receive an email about every couple of months and keep up with the coalition's work and stay on board with us. And we have some people who are very good about getting the information out, and invite you to join us on June 21st, Saturday, for Walk in Their Shoes, which is a fun, and friend-raising event to assist the Concord Coalition on Homelessness. We'll be walking to and from the Friendly Kitchen, visiting various sites of the city. It's a great consciousness-raising tool, and there'll be more about that coming out in the next few weeks.
I just wanted to say 2 quick things. I think one of the reasons why I really wanted to do this is because I wanted to get a point across that homelessness doesn't look like anything in particular. It can happen to anybody regardless of gender, race. If you've never had any problems with substance abuse, it doesn't matter. It can just happen. It can happen with the loss of one paycheck. And the other thing I wanted to say is now that, well, when I moved out of the shelter, I actually went back like a month later to volunteer, and in turn was actually offered a job there. And that was 2 years ago. But in that process of working there, I'm just amazed at how much I've learned about the different agencies in Concord and how much they communicate. And you know, if we get a call from somebody who isn't a family, doesn't have children, just the resources that we know to call to make sure we try to service everybody has just been amazing, and I continue to learn more every day. I'm just grateful.
Hi, I heard a clear political sort of message coming through in that movie. A socioeconomic divide that was a gap that had been growing over 40 years. How do you feel about that, and what do you see your role in addressing that dimension of the homeless problem?
I have a graduate degree in economics, and the people I follow who's one of the most articulate and accessible scholars speaking today is Robert Reich, Labor Secretary in the Clinton administration. He has just put together what has been the focus of most of his lifetime work, which is about the widening gap in income equality and the erosion of the middle class. And the movie demonstrated tonight a lot of what Robert's been working on for years. I think he's at Berkeley. And I think there's very clearly a polarization of income. We are losing the middle class, and most of them are dropping down. And I think that's something that ought to be a concern to us and ought to guide our choices and information as voters and as citizens of this republic. And I have ordered it. I did not get the DVD in time, but he has produced a new DVD that runs about 90 minutes. He's an interesting, entertaining, and fascinating scholar. I wish I'd had him in graduate school, and I would commend some of those works to you as responsible citizens.
I know that what we've talked about tonight is certainly not foreign to many of you. I think going forward, I think Dan's certainly put some information out that'd be valuable for everyone here to continue to pay attention to this as a subject. I don't think you can ever learn enough about it, and I think for any of us who are in the field, every time we think we've got something figured out, we realize that we really don't have it figured out. It takes an ongoing effort to address any type of problem, and it just doesn't stop by simply hoping it goes away. It requires people to work on it from a wide variety of ways. I echo what Lori said. I believe the folks that are in the service agencies really do try to work together very well. I think sometimes folks who aren't in those organizations don't believe that's the case. I've actually found it to be just the opposite. I've been overly impressed. I'm not overly impressed, I'm extremely impressed with having seen how organizations that deal with different things hand off, get back from each other, and try to find things for folks all the time, because really that's the only alternative we have. Our organization uses resources from the Resource Center and Families in Transition and all these other things. There's an awful lot of collaboration. I think a lot more than sometimes the general public ever realizes, and I think to Maureen's point, that's what sometimes feels like maybe there's not enough appreciation, or I'd say respect or understanding that these resources do work hand in hand and are trying to do the best they can for their clients every single day.